Hi and welcome. I am trying to learn medicine. Today, Anorexia Nervosa. And after we've done it, we're going to do squat training. And if you participate in the squat training, then is that at your own risk. And we're talking here about a medical condition and also about a psychological condition and eating disorder. And this is no medical advice. We're just reading about it. And this is part 2, I think. And now we're trying to gather the informations together, or the core informations, and then I try to make a presentation about it. Anorexia nervosa, a disorder in which the individual refuses food because of an unnatural fear of putting on weight. Okay, that is the definition. Anorexia nervosa, a person has an unnatural big fear to eat, or doesn't want to eat because of an unnatural big fear to gain weight. It mainly affects adolescent girls in affluent Western communities, although occasionally older married women may be affected. 1 in 15 patients is male. Maybe we want to say it, that 14 out of 15 are female, 1 in 15 is male, and mostly it is by adolescent girls. Anorexia nervosa is becoming increasingly common. A recent survey in Scotland showed that 3 in 200,000 suffer from it. 3 people in 200,000 suffer from it. The condition is distressing for the sufferer's family and friends because they cannot understand her or him subconscious self-deception regarding the need for food. Okay, we're going to save it somewhere. That it is for the people around them oftentimes hard to not understandable why the person does not want to eat. The sufferer convinces her or himself that she or he is too fat, that she or he has not lost weight, and that she or he does not need either treatment or food. And oftentimes the person sees themselves not as too lean, and thinks that they don't need treatment and that they don't have to eat. She or he is unlikely to listen to advice from family or friends about the need for food, so they should be prepared to seek medical help on the patient's behalf. Treatment is essential, and although most cases recover, occasional fatalities do occur. Okay, symptoms. Failure to eat for long periods. Loss of weight. This may be considerable and obvious to everyone except the sufferer. Vomiting occurs. The patient's changed attitude towards food leads to vomiting being self-induced, often concealed by the patient. Menstrual periods stop, and in males, sexual desire is lost. Reluctance to undress in front of others. Okay, the symptoms are loss of weight and a willing not to eat, and also a self-conception of being too fat or not too lean. But we could add, but I'm not sure if it goes too much into, if it is part of anorexia or if it are subtypes of anorexia. But I had the idea, we're going to take the information like that as they're written here in this book from the 70s. If we find out that there may be new information to it, we're going to retitle the video to the medical knowledge about anorexia in the 70s. Just basically as an historic medical thing. Again, this is no medical advice here. I'm just reading this book. Duration, from a few months to 3 or 4 years. The causes are uncertain, but the condition has many features of phobias and compulsive obsessional behavior. Disturbances in secretion of sex hormones may occur. Strained family relationships and emotional upsets are extremely common, but it is often not clear if these have preceded or followed the onset of symptoms. Severe loss of weight, anemia, fertility, and loss of sexual desire are common. Treatment in the home none is advised until medical advice has been sought. What a doctor might do: get the sufferer to accept the need for medical help. This is usually the first and most difficult step in the treatment, and also to confirm the diagnosis and refer the sufferer to a psychiatrist if the patient is willing, and often the patient will accept treatment only from the family medical doctor. When a target weight is looked out and it is tried to be achieved, and when it's also looked at if the person is admission to hospital, that the food is eaten and that vomiting is not occurring and not concealed. Prevention unknown. In about 80% of cases, response to treatment is good. About 20% are unaffected by treatment, and the symptoms may continue for several years. Okay, the informations are, it is a condition in which the person refuses to eat over a long period of time because the person thinks that they have too much weight. It's because the person thinks that they have too much weight. It is over long, if the symptoms are to lose a lot of weight, and most people around them notice that, but the person who has it does not see themselves as too lean. I think we should also mention the other things. Menstrual period stop, sexual desire lost, reluctance to undress in front of others. Oftentimes, the condition is distressing for the sufferer's family and friends because they cannot understand their subconscious self-deception regarding the need for food. It is oftentimes complicated for the people around them because they cannot understand why that person does not want to eat even though that person gets leaner. Medical advice should be sought, and then it is talked about the medical condition and try to help the patient to accept that they have anorexia nervosa. And then it could be a target food set, and it is looked at vomiting is not concealed or self-induced, and it is tried to achieve a weight target. In most cases, this helps to get rid of it. I'm going to start the camera. Second one. Anorexia nervosa is a condition in which the person thinks that they are too fat and refuses to eat, even though they are actually getting leaner and leaner. So symptoms are to, over a long period of time, not wanting to eat, even though the person loses more and more weight. And oftentimes the family and friends around them notice that, and they cannot understand why the person thinks that they are not lean. So the people around them see that the person gets leaner, and they cannot understand why the person who has the anorexia nervosa does not see that they get leaner, but they are getting leaner. And furthermore, symptoms are then stop of menstrual periods and also loss of sexual desire and also reluctance to undress in front of others. And now the people can get help, and oftentimes, and it is better to get help instead of doing it in the family also. It is better to get help, said in this book. And when it is talked about the condition, and the first and most difficult step is to make the person accept and understand that they have anorexia nervosa, that they are not overweight, that they are not normal weight, but they are underweight. When a target weight is set, and when it is tried that the person can eat again, and that they don't vomit, and also not self-inducing the vomiting, and that they're reaching the target weight. And in most cases, that works to get the person back to a normal healthy weight. And that is according to Keith Watkins' Family Medical Advisor book, page 75 and 76, but this is now medical advice. Again, this is now medical advice. I'm going to stop the camera. And And let's pause on the leg apart. If you were here for medicine, you can go directly to the next part of medicine. If you stay here and participate in the squat training, that is relatively hard. We are warming a little up. We're bringing one leg up. Pull the leg up, point with the toes down, relax the leg. And the other one. Pull the leg up, point with the toes down, relax the leg. And now, legs a bit apart, and we're doing 12 squats. So first one, and the second one, and the third one, and the fourth one. And now to number 5 and 6, and with that we're having the half. We're going strong into the next part. 8 and 9, and we're having 10, and only last 2, 11, and last one, 12. And now the 6-pack squat squeeze. Legs wide apart, down into quarter squat, and press against the top of the leg on the one side only. And now on the other side. And down into a half squat, and press in the middle of the leg. And on the other side. And now down into a 3/4 squat, and press close to the knee. And on the other side. And up again. And now the fastest giraffe of a water polo. Down into 3/4 squat. Press against the knee. And go towards it. And again. Press against the knee. And go towards it. And again. And again. And last 2. And one more. And up. Last exercise, the propeller. Down into full squat. Arms up to the side, over to one side. Press against the leg and look up to the head. Into the middle, over to the other side. Press against the leg and look up to the head. In the middle and up. Now again a bit stretching. Again one leg up. The other one. And up. Take the leg at the ankle. Make a straight leg. And point the knee down to the ground. Other leg. Straight back, knee down to the ground. Legs wide apart, breathe in, go down. Breathe again out. And in. And out. Breathe in. Your hands are touching and open up. It was a squat training. I thank you very much, and at the next time.